Wow, President Mahama saw be constructing 600 chip compounds. Sanity. Again, mukaya me no analysis be on the district assembly common fund. Mahama saw at least 25 million cedis every quarter to a district assembly or 261 district assembly at the last check. We be breaking it down. My didn't President Mahama person constructed 600 chip compounds. In that conversation, what will happen to agenda 111 President Kufuor has started 88 district hospitals, some 6 regional hospitals, only mental health facility near the end. What happens to those facilities? So let's go to the health conversation today. I have critical analysis channel. Make sure to subscribe me. Or subscribe and click the notification and me the video via tuma. Ubehu na weti me ashebi. Now, Osha Ghana chip compounds. You catch chip compounds the meaning, don't say C and your chips and your spell chips, say be a CHIPS. We know a CHPS. The full meaning, no, a National Community Health Planning and Services. National Community Health and Planning Services. And your first time, your President Mahama and Niako chip compounds. Umbakaya 2016, Obrebe president, no, Oko Nadoli Kalio, and Oko Lanche chip compound policy, now commissioning 64 chip compounds in the region. Now, the Upper West region, President Mahama the first time, no. OBA 64 chip compounds. What are chip compounds? Chip compounds are also talking to a physician assistant back could be omoye minor cases and send the muya de bom do district hospital. A muya de local regional hospital. If regional hospital could be a teaching hospital. It's a confanoche. And the chip compounds are very important. Now chip compounds, the history date back to 1977. Under a champon. And your cancer Ghana, your health insurance, your health upon some now form. In the end, lunch be a friend of such chip compounds. Now, let me give you some bit of history. The main objective of the lunch say bridge the equity gap in access to healthcare and nutrition services and ensure sustainable financial agreements that protect the poor. In Tenya apomodin keke. Nipana healthcare ni BBA count. Sana me catch on 1997 and he adopted chip compound policy no. Ewo honom. Na enra me na internet na so me back no. Ana me say me hwe video bi on Felix Kwachi Ofosu ana me TB.
To the Assembly's Common Fund, and my DC is right behind me, so he's fully aware of this. Each district is required to construct 2 new chips compounds this year. Each district. So if you put that together, we are talking in excess of almost close to 600 chips compounds that will be put up this year alone, or at least work on them will start this year. If we maintain the tempo, that should give us over 2,000 chips compounds in the next 4 years, and this is a significant step towards improving healthcare services for the people of Ghana, because even the Abokomano chips compound that I put out sometime in April last year, it's not too far from here. The information I have is that between that time and now, close to 1,000 patients have received healthcare in that facility, and that is a modest facility. So you can imagine the sort of impact that will be made if 2,000 additional chips compounds are built by this government over the next 4 years, and that would provide access to healthcare for millions of Ghanaians, and this will go a long way to improve healthcare services across the country. So we are very committed to ensuring that our people have access to quality healthcare, and at various levels we will make efforts to invest in health facilities that meet the needs of the people. Yeah.
Yes, into each district, see 2 chip compound this year ya na say by December I see 2 new chip compounds our district. Now some say 261 chip compounds 261 by 2 no 522. Now at least 522 new chip compounds ebeba. Now me tell them say then that means that agenda 111 may be in trouble, because then council ya start be brain catch just about 15%, 10% in a way. And this is where I always come back to this issue. See, your policy, let's have a national buy-in. Agenda 111 near the GOG funds there, buying sick and day. Now the question I want to ask the NDC government is that most started chip compounds, what happens to Agenda 111? Where are we going to get the money to fund it? It's a very important question we need to ask. Because in Kenya, there were a lot of hospitals that carry NMSI and the Kufa de Yade. Oto Kodu and way in America. Obewie, Oka Erojet NMSI Buma, Kumasin Kwan, Ashanti Menkai Krano, Obewie Tepa, Owie Konongo, Owie Fomena, Owie Kumawu, Owie Bekwai man for Bekwai, NMSI, and Erojet Nako Fossat, NMSI Mills Mahama 2012-2014. Erojet Yakofo, enye mubia no a champion and a statue be Bekwai hospital no. So the conversation those say is good. Applaud the chip compounds. I mean, you implemented the 1979 champion policy or the by any but what happens to the agenda 1 hospitals? They be because I buying several times says you
understand me? If you come to that sector, there are high-headed problems. As we speak, the agenda 111, which the previous government made noise about, at the transition team meetings, we discovered that only 3 had been completed. Even then, they are not functional. As we speak, they cannot admit.
The president says 70%.
No, they cannot admit patients, and so none of them can admit patients today. Then we discovered that we need a colossal $1.4 billion, which is close to 30 billion Ghana cedis to complete them. So it is the headache of Honorable Akando when he takes office to think about how he's going to manage this.
So Siko here this one. Why are we not focusing on raising money to complete some of this project before you move it to the chip compounds? No? Is it possible to do that? Can you have the financial wherewithal to do that? Again, under the ND, some promises a big push in the new infrastructure. You be raise Sika near the Akoye. Minya president and minister, I ask them those questions. Big push and saying Sika no more raising. Then the 111, what should be the completion rate? Yen sheni mu dabeng say be wi agenda 111 because I important. I am careful and also be carry 4 years and we deprive about 88. Whether I could for the TV commission trepe. I think so commission my check him out. I think so commission 3 me kai ba ko commission here ewo Ahanta West and we Bukuru. Yes, or commission Bukuru said that the no so no ma wi and no signature one no be launch ewo you can say the achima kwahoma ofurukrum so oyeye o commission ofurukrum to ofurukrum achima kwahoma se me ka trade ana Ahanta West ne wo Bukuru titiri we no timi commission ye rest na akarom e wo wuram ese ye enyina mu de na nsem fa kwan so no mehu se no so e build up nice letwa east yempesika ni wie ni nyina emfiri wo because yenwie a ebeka wuram and I would love to hear the government on agenda 111 very important say adwen cost ni wie ni nyina concurrently na yete yensa e different. I don't know what you think of this, but I think it's a good thing, but me yem san se say e bia na sika ye de bewie other existing ones on ama. I would like to hear your view on this. This is my thought on it. Make sure to subscribe and subscribe and click the notification. Me the video be to ma obehu no watimi ahwe bi se na de bia me kan Ghana hian ana me nsumi hian. Make sure so be show so ye dem ma me. Bye bye.